Retshidisitswe, thank you so much for joining us. I want to talk about your personal journey. At the beginning, were you feeling a bit fearful, a bit comprehensive when you learned you had to tackle this virus at the beginning?
At the beginning, I was actually quite excited. I was looking forward to learning more about this virus that everybody's talking about, and I was hearing about it for the first time myself, so I was very excited to be part of the team that gets to tackle this pandemic.
Okay, so take us through the process then on a daily basis. We're all talking about PPE and so forth. Do you feel you're well resourced to tackle this at the moment?
At the moment, I'd like to say that yes, I feel we are well resourced, and we're receiving quite a huge number of donations, people coming forward to provide PPEs to different and various areas in the country. So yes, we are well resourced.
Okay, so now when you're going in to deal with patients who are suffering from COVID-19, you know, what's your biggest fear? Because when you look at worldwide, you look at a lot of nurses who are contracting the virus themselves, and also you're also fearful that you might actually take the virus back home. What's your biggest fear?
My biggest fear is not being able to make a difference in that particular person's life, you know. I think the real reason I leave my house in the morning is so that I could go help somebody. So my biggest fear is actually not getting it right.
Your biggest fear is actually not getting it right. And how do you stay compassionate? You know, how do you stay positive?
How do I stay positive? I'm a very self-motivated person. I've always been passionate about healthcare and always known that I wanted to be a healthcare provider. So for me, it's knowing that I can and I want to make a difference in somebody else's life.
Okay. Take us through one of your most difficult moments when you're dealing with some of the COVID-19 patients you've dealt with.
The most difficult moments is the stigmas, how people approach the COVID, the ignorance as well. People have already made up their minds, and people have come up with their own conspiracies as to what COVID-19 is all about. So that is my biggest challenge, having people understand the COVID and the seriousness of it. That is the only challenge that I think stands out for me on a daily basis.
All right, Retshidisitswe Kotane, keep up the good work, keep up the fight. You're the guys who are right at the front line of the COVID-19